Application Workshop, Part 2, Strategy. You are viewing Part 2, the strategy of the application process for nursing. It is designed to help you maximize your point total and make you more competitive. Part 1 of the application workshop is one of the required criteria for gaining access to your nursing clinical entry application and is a separate presentation. As we continue the presentation, we will discuss the strategy of building your application, how credentials can increase your total, the process of how to proceed if you find errors on your nursing clinical entry application, the process of changing county residency. This photo was added so you can see what you will be doing as soon as your application is accepted. Make it as competitive as possible. Helpful handouts. In addition to viewing this presentation, be sure to download these helpful handouts that provide more detailed information and that you can use as a reference. The strategy. The first key in understanding the strategy of building your nursing clinical entry application is studying the handout called Clinical Application Worksheet. When you're strategizing, you might take a biology class before a math because the biology has more point value on the nursing clinical entry application than math, though both are ultimately needed for graduation. A student will realize the importance of getting a grade of A or B for GPA calculation, point total, and nursing program preparedness. The point difference for better grades adds up quickly. We have seen one student receive the offer of a seat before another, and the only difference in their application was grades in courses. They make that much of a difference. The list of automatic course substitutions is also found on the clinical application worksheet. As an example, if a student has a higher level math course on their transcript, the system seeks those out and allows for the substitutions found on the chart. The system is designed to take the higher of the two grades when substitutions are used. Credentials for your nursing clinical entry application. Some credentials earn points on the competitive application. If you have an associate, bachelor, or master's degree, it must be from an accredited institution. Another credential for points is AHS 117 or a CNA waiver. This is a student's choice, but please note, a grade in the class can earn you as many as 5 points. The most points earned for a waiver is 2. We have changed the application to allow more points for BSN courses than students are taking. We are encouraging these courses because our employers are requiring ADNs to be in BSN programs upon hire. What if there's an error? If your credential isn't showing when you view the nursing clinical entry application, you may contact admissions for a review. For questions about grades or courses, contact Marilyn Angoli and Student Records. This request must be made at least 1 week prior to the application deadline date. The handout called Criteria and Instructions Sheet is vital to understanding this process. Service area, residency. A student whose residency is Anderson, Oconee, or Pickens County earns 4 points on the application. If a student lives in one of these counties, but the report does not show 4 points at that section, a student should go to www.tctc.edu to Student Life and Services to Residency Status and follow the directions to make the request for a residency review. In summary, as you take courses and achieve credentials, you are building a more competitive application. The students who are paying attention to this process from the beginning of their college entry are the ones who are maximizing their point capability and entering nursing when they are ready. To review the details for eligibility, access, and submission of your nursing clinical entry application, you may review Part 1 of the application process. Best of luck as you build your nursing clinical entry application.